Welcome to my channel Primoltalks. Today we are starting with Periodontology series. In this series we would be covering every disease under 5 key points, that is fundamental aspect of disease, key symptoms, common causes, diagnostic methods and treatment options. So starting with the periodontium, as the name suggests, peri means around and dontium means tooth. So we would be covering tissues which surround the tooth. It includes basically the investing tissues and the supporting tissues. The investing tissue is the gingiva, which we will be covering in detail, and the supporting tissue includes periodontal ligament, cementum and alveolar bone. These three also we will be covering in detail in the upcoming lectures. Now starting with the gingiva. Since gingiva is a big topic, so we would be covering gingiva in various parts. So starting with the part 1, which includes the gingiva and its types. Oral mucous membrane. Oral mucous membrane is a membrane that lines the oral cavity. It is of 3 types, that is masticatory mucosa, the specialized mucosa and the lining mucosa. The masticatory mucosa, it includes the gingiva and the hard palate. The specialized mucosa, it includes the dorsum of the tongue. Lining mucosa is the rest of the mucosa, which includes the labial mucosa, the buccal mucosa and the soft palate. Now we will be discussing gingiva in detail. So what is gingiva? Gingiva is basically the soft tissue which surrounds the tooth in a collar-like fashion, which surrounds the neck of the tooth in a collar-like fashion. So gingiva is that part of the oral mucosa which covers the alveolar process of the jaws and surrounds the tooth in a collar-like fashion. As you can see in this diagram, the gingiva is surrounding the tooth in a collar-like fashion. Now, what are the types of gingiva? There are 3 types of gingiva, which includes the marginal gingiva, the second one is the attached gingiva, and the interdental gingiva. Third one is the interdental gingiva. Okay, now coming to the marginal gingiva. As the name suggests, it forms the terminal edge or border of the gingiva. So this is your marginal gingiva. It forms the terminal edge of the gingiva or border of the gingiva, and it surrounds the tooth in a collar-like fashion. Now attached gingiva. What is attached gingiva? It is continuous. If you see here, this is continuous with the marginal gingiva. It is firm, resilient and tightly bound to the periosteum of alveolar bone. Okay, so these two you can understand better with the help of this diagram. So if you see here in this diagram, the 3 types of gingiva I have marked here, that is your interdental gingiva, the marginal gingiva and the attached gingiva. So if you see here, the one I have marked with the yellow marker here, it is your marginal gingiva. So this marginal gingiva, it is surrounding the neck of the tooth in a collar-like fashion. Continuing with the marginal gingiva is your attached gingiva. Here the one which I have marked with the orange marker. So it is continuous with the marginal gingiva. It is firm. It is tightly bound to the underlying periosteum of the alveolar bone. Now if you see this red line here, okay, this red line here, this is what? This is the free gingival groove. Okay, this is free gingival groove. It is present only in 50% of the cases. Rest all will not have this groove. Only 50% cases will have this free gingival groove. So this is what? This is a demarcation which demarcates, this groove demarcates your attached gingiva from that of the marginal gingiva. So this groove that demarcates marginal gingiva from the attached gingiva. Okay. Now if you retract your lip, these type of fibers will be seen in the mouth and you will see a sharp demarcation here. This is what? This is your mucogingival junction. This is mucogingival junction. So this mucogingival junction, it will separate your attached gingiva from that of the oral mucosa. So this will separate your attached gingiva from that of the oral mucosa. Now coming to the third type of gingiva, that is your interdental gingiva. This you can understand better with the help of this diagram. So you see, if the two teeth, if they are in contact with each other like this. See, I am drawing here these two teeth, they are in contact with each other. So here you can see this is the gingival embrasure. So this gingiva, this will be occupying this gingival embrasure. So this is your interdental gingiva. Okay, this is your interdental gingiva which occupies the gingival embrasure, which is present beneath the point of contact of tooth. So this interdental gingiva, it has three parts. What are these three parts? These are your facial papilla, your lingual papilla, and a valley-like depression which will be connecting this facial papilla to that of your lingual papilla. So this is what? This is gingival cole. This valley is referred to as gingival cole. Okay, so if you see here, we can revise this. So this is your gingival sulcus. Okay, the V-shaped crevice that we will be discussing. Then this is the marginal gingiva which forms or surrounds the tooth in a collar-like fashion. This is the attached gingiva which is in continuity with the marginal gingiva and is firmly attached to the underlying periosteum of the tooth. This is the interdental gingiva which occupies the gingival embrasure which is present beneath the point of contact of tooth. It has three parts, that is your facial papilla, lingual papilla, and the valley-like depression connecting the facial papilla to the lingual papilla, that is your gingival cole. Now coming to the width of attached gingiva. Okay, this is important. Width of attached gingiva. Okay, so what is width of attached gingiva? Okay, so width of attached gingiva, it is the distance between the mucogingival junction. As you can see here, this is the mucogingival junction. The distance from here till the base of the pocket or base of the gingival sulcus. Here if you see, this is the base of your gingival sulcus. The distance from here till here, till your mucogingival junction. So this is what? This is the width of attached gingiva. So this width of attached gingiva, it varies according to the region. That means if you are seeing with respect to maxilla, if we see, then it will be greatest in case of incisor region. Okay, in the incisor region it is the greatest, and it is the least in the premolar region. The same goes for the mandible. If we see, then it is greater in the case of incisor region. It is greater in the case of incisor region, and it is least in the case of premolar region. Okay, so what are the values for these? In the incisor region, in case of maxilla, the incisor region, it is greatest. The value is 3.5 to 4.5 mm. Okay, and in case of premolar region, it is least, that is 1.9 mm. In case of mandible, it is greater in case of incisal region, that is your 3.3 to 3.9 mm, and in case of premolar, it is 1.8 mm. So this width of attached gingiva you need to remember because it is very important. So the width of attached gingiva, it is the distance from the gingival base of gingival sulcus to the mucogingival junction, and this distance, in case of maxilla, it is greater in incisor region, that is your 3.5 to 4.5 mm. In premolar region, it is 1.9 mm. In case of mandible, it is greater in case of incisor region, that is 3.3 to 3.9 mm, and in case of premolar region, it is least, that is your 1.8 mm. One more width which is of clinical significance is your biological width. Okay, now what is the biological width. This is of great clinical significance. You see, this is the CEJ, that is your cemento-enamel junction. Here you can see this is the junctional epithelium. So the distance from the junctional epithelium till your alveolar crest, this is the alveolar crest of the bone. So distance between your junctional epithelium, that is this is the junctional epithelium. The junctional epithelium, this distance from the junctional epithelium to the crest of alveolar bone, this is your biological width. Okay, so its value is 2.09 mm. It is of great clinical significance as it acts as a protective barrier. This acts as a protective barrier in helping the prevention of invasion of the bacteria or microorganisms. So it will prevent the invasion of microorganisms. So this biological width, maintaining this biological width is of great clinical significance in order to prevent the infection. Okay. Now coming to the epithelium. Now coming to the gingival sulcus. This gingival sulcus. What is gingival sulcus? It is a shallow crevice. See this gingival sulcus. Here you can see this is a shallow crevice or a V shape. This is a V-shaped space. Here, this is your sulcus, gingival sulcus. It is surrounded by the tooth on one side. It is bound by tooth on one side, and on the other side, you will see the free margin of the gingiva. That is epithelium lining the free margin of the gingiva. That is one side there will be sulcular epithelium, other side it will be bounded by the tooth. So here the thing that is important is your histological depth. Okay, histological depth. So this histological depth is 1.8 mm. This is important. Okay, and the other depth which is important is your probing depth. So this is 2 to 3 mm. Okay, so gingival sulcus, it is a V-shaped shallow crevice which is bounded by tooth on one surface, and on the other surface it is bounded by the epithelium, the free margin of the epithelium. The histological depth of the gingival sulcus is 1.8 mm and the probing depth is 2 to 3 mm. Now coming to the epithelium, there are three types of epithelium, that is your sulcular epithelium, junctional epithelium. This epithelium we have already discussed here. This is of great clinical significance. And the third one is your outer epithelium, or you can also call it as oral epithelium. So the sulcular epithelium, what is sulcular epithelium? As the name suggests, it lines here. This is your sulcular epithelium. This lines the gingival sulcus. Okay. Now junctional epithelium, this we have already discussed. This is of great clinical significance. It is a thin layer. This green layer as you are seeing here, this is the junctional epithelium. It is a thin layer that attaches the gingiva to the tooth surface. So this thin layer will be attaching the gingiva to the tooth surface. The third one is the outer epithelium. This outer epithelium, it is formed by your free gingiva plus attached gingiva plus your free gingival groove. You see here it is the free gingiva or marginal gingiva. This is the attached gingiva and the marginal groove here, free gingival groove. It will be formed by all these three features. Okay, junctional epithelium, it is non-keratinized. As you can see here, no retipex can be ruled out here. Then again sulcular epithelium, it is also non-keratinized. However, this outer epithelium or oral epithelium, it is keratinized and it has a lot of retipex. As you can see here in this diagram, it has lot of retipex over here. Okay, so all these three types of epithelium I will be covering in my next lecture. Thank you for watching our video. Your feedback is really important to me. If you have any queries or suggestion for future videos, please leave a comment below. I would love hearing from our audience and I will always be looking to improve my content. Don't forget to like, subscribe, and hit the notification bell to stay updated with my latest videos. See you next time.